County. My name is Mark Peters, and I work with the County Health Department as the Director of Community Health. And it's time once again for our annual health checkup. With the release of the 2017 County Health Rankings, we have an opportunity, the Health Department and all of its partners who serve as members of the St. Clair County Healthcare Commission, to take a look once again, as we did last year and as we've been doing since 2010, where we stand in comparison with all of the other counties in the state of Illinois, of which there are 102. The news is, while not surprising, certainly not good. This year, out of 102 counties, we are ranking 95 on some conditions known as health outcomes, and we are ranking 91 on conditions known as health factors. And the way that is set up is this is based on a national study. The Robert Wood Johnson Foundation funds this project and has been doing this for every one of the 3,000 plus counties across the United States, state by state, taking data and information, health information from some 35 plus different sources, and trying to line that up and help counties and their community leaders understand how the big picture of health comes together. Most of what's driving our poor county health rankings certainly has a lot to do with our health outcomes, and that is driven primarily by the estimated time or quality of life, premature mortality. And so we've really taken a look at some of those things, and we've not done as well as we can. We are dying a lot sooner than most other counties. It's kind of rough way of putting that. The other things have to do with health factors, our behaviors like smoking, obesity, inactivity, healthy nutrition. A lot has to do with our poverty levels, okay? Our insurance, and people that have access to some of these things. And we know that we've got a tremendous number of inequalities in our county that we're trying to work on. So that's the stuff we know. We also know that we can change these things. Individuals can certainly get more active. Communities can kind of create those policies and those environmental changes around that. And that's really what the Healthcare Commission has been trying to do now for almost 25 years. And with the release of the county health rankings, we look at this time in the spring of every year to see where we stand, what are other counties doing that seem to be improving some of their health outcomes. I also want to point out that as we look at this information, we need to be aware of the fact that it's going to take a long time for us to kind of improve our health. Over time, they say it's going to take maybe 5 to 10 years to try to address some of these chronic disease patterns, certainly some of the poverty issues, the economic and the social issues that are driving these things. And for the most part, experts say that only 20% of our healthcare system, or 20% of our health, is driven by our healthcare system. Other things that are factoring into that have to do with the environment, the quality of our air, our income levels, our economic indicators. So all of those things are what we're trying to work on together as members of the St. Clair County Healthcare Commission. If you're looking for more information, please feel free to contact your local health department or go directly to the site, countyhealthrankings.org. Thank you very much.